Joe Theismann, world champion quarterback and entrepreneur, here with Dr. Carlos Gonzalez, who, by the way, is a chiropractor, and I get to see a lot of chiropractors quite often, as a matter of fact, because of the way my body has been beat up over time.
Absolutely.
But you're not just a normal chiropractor.
That's right.
Now, what makes you different?
Well, Joe, it all started when I severely hurt my back. I was in college, and my mother would tell me, son, go see a doctor. Son, go see a doctor. And I always say, Mom, all they're going to do is give me pills. I don't want to go see a doctor. Well, after a couple of months, my back was still killing me. I finally went to go see a doctor, but guess what they did?
Gave you pills.
Exactly.
Of course, why not?
And I didn't take them, and I finally went to go see another doctor, and guess what they did?
Gave you more pills.
More pills. And then they said, if the pills don't work, we're going to do some injections, and then we're going to do surgery.
Right.
I said, no, thank you. Well, as life has, change of events, and, I met a chiropractor. I went to go see him, and it changed my life forever.
How?
He fixed my back. He showed me exactly where in the spine my problem was, where it was pinching a nerve, took some x-rays and showed me exactly where and fixed it, and it was like new again. And that forever changed my life. I said, I want to be a chiropractor just like this chiropractor helped me. I want to help other people. And the rest is history.
So that's really how you got involved, was experiencing the pain of so many of us that go through back pain as it is. As you now work on people, as you develop a program to help people, what's the most important thing you can tell somebody that has back pain now?
Well, Joe, back pain is so common. 8 out of 10 people will suffer from back pain at one time in their life, if not already. Wow. 80% of the population. It's a $5 billion a year industry. It's huge. And so what I try to do is I try to teach people how to be their own best doctor. I teach them things that they can do to prevent back pain from ever happening. Because if you can prevent it from happening, that's that much better.
But let's say you have it, like I have back issues, okay? What can I do to help myself? Which is, it's interesting talking to a chiropractor, trying to help myself as opposed to saying, hey, come and see me, I'll fix you.
Right.
But you really want to help people. You'd rather not see people if you don't have to, right?
Absolutely.
And what would you say to me with your back problem? Joe, what do I need to work on?
But you know what, Joe? Here's the thing. Even as much as I teach people what to do, they still need to come see me, but not on an as often basis.
Yes.
That's the key.
So it's really, you become you're a mechanic. You're sort of working on the car a little bit. You don't want to rebuild it. You don't want to totally fix it.
Right.
You don't want to put a new transmission in.
Right.
But you want to modify it so that it runs smoothly.
Right. So let me just explain a little bit. Here is a disc herniation, okay?
Which is
this little red spot right there. If the camera can zoom in a little bit, we can see the disc herniation right there. And what happens when people get a disc herniation, it pinches on this nerve. It puts pressure on that nerve. And if it's in the low back, then that's the sciatic pain you're going to feel down the leg. If this is not corrected, it can cause severe pain, debilitating pain.
I've been there.
I've been there too. Yeah. And so what happens also is we have another problem called degenerative disc disease, which you told me you have, and I've had it since I was 30 years old. So here's what we do. By using some of the techniques that I use,
I'll hold these for you.
Here is the spine, a herniated disc, kind of like I showed you on the model. And when we open up those vertebrae, then the disc can open up and the herniation will reabsorb back in to where it's supposed to be. Now, we do this through a combination of techniques. One of them is inversion therapy. Now, you can hang...
That's not upside down, right? That picture's not upside down.
No, that's the way it should be.
That's what I was looking at. I'm thinking...
Right. See, this person is hanging at a slant.
Okay.
Okay. And he's not completely upside down, but he's at a good enough slant to where it'll take pressure off the nerve.
Okay.
And off the disc and the nerve roots. Here's a picture of somebody else at a more angle, more of an angle.
Right, more acute angle.
Right, more acute angle, taking more pressure off. Now, the problem with hanging from the feet is that some people tell me it hurts my ankles.
Well, I've tried inversion techniques. It hurts my ankles, but also my head feels like it's just filling up with a bunch of blood. I mean, it's like the blood's flowing down into my head.
But that's a good thing, Joe, because what happens in UFC, how do they put the guys out on a chokehold?
Put them to sleep.
How?
They limit the blood. They limit the blood flow to the head.
Exactly.
Okay.
So,
will it make me smarter?
It actually will make you younger.
Well, okay. I'll take 1 out of 2.
Because here's the thing. There is research being done where increased blood flow to the brain is good for degenerative diseases like Alzheimer's and Parkinson's. See, we want to increase the blood flow to the brain.
Okay.
Now, there are some indications where we have to be careful. Not everybody can hang upside down.
Right, that's what I was thinking.
Not everybody can hang upside down, but the majority of my patients, I will allow them to do a much gentler slant like that. And then if they can tolerate that, then we go on to something more.
More severe.
Right. And then you can go completely upside down like this, okay? But again, some of my patients tell me, Doc, this hurts my knees, this hurts my ankles, this hurts my hips. And some of my patients tell me, man, does it feel good. After I go for a long run, I get on my inversion machine and this feels wonderful.
So it really becomes personalized.
It is.
I mean, it depends on, and this is what you do. You try and personalize the treatment that people are going to get for their problems based upon the reactions that you get from trying different things.
Before somebody goes out and buys an inversion machine, I tell them, look, let's put you on one of these and see how you feel.
Right.
And then let's put you on one of these machines and see how that feels. Because if the other one hurts your knees, your ankles, or your hips, then we're going to put you on one of these.
Is he upside down like that?
He's upside down, but he's hanging from the thighs.
Okay.
Okay?
Okay.
Now, what I've developed over the years from personal experience and from working on thousands of patients, tens of thousands, I've kept so many people from spinal surgery. And this is what I'm trying to get the word out, that you don't have to go for these injections. You don't have to get those steroid injections. You don't have to get surgery. You don't have to learn to live with the pain like so many doctors tell people. You don't have to take the pills forever. I've developed an adjustment technique that while you're upside down, I adjust your spine from here down to your neck. In addition to adjusting your spine while you're on the treatment table, in addition to some stretches, in addition to some therapy and some massage and some exercises that I have patients do while they're upside down.
Coming to exercises and the inversion and different type of techniques are great. What are a couple of basic exercises you can share with people, and me in particular as well, with regards to trying to help my back along? Say I get up in the morning and my back is stiff. What can I do?
Well, simply there's a yoga stretch where you stand up and you just go sideways. And you hold your wrist with one hand and you just stretch sideways. Yeah, you pull, and then you do the other side. Okay, that's a real simple stretch.
Can I do it lying down in bed?
You can.
Really?
You can.
That might be a little more appealing to some people.
Yeah.
I mean, see, especially for somewhat older people from time to time, I think it's hard sometimes to maintain that flexibility as we get older.
Right.
But yet it's so vital and important to feeling youthful. Is having the opportunity to be able to be more flexible and stretch.
Absolutely. Now, core strengthening exercises is very important to strengthen not only the abdominal muscles, but the back muscles. While you're hanging upside down on this machine, I have the patient lift their body and lift their body. And you can see some of the videos that I posted on my YouTube channel. They're different techniques. There's different videos. There's
different degrees, I think, that people can do.
Right.
So really, as we sit and visit here, you want to customize for people with back issues a program that fits them.
Right.
It isn't a one shoe fits all type of philosophy. It's a customization.
Right. It's not, go get one of these inversion machines and hang upside down. I had a lady tell me the other day that she got on one of these. She had no instruction. Nobody taught her how to do it or what to do. She was having back problems, and that's why somebody let her borrow it, and she messed up her back even worse. Right. So somebody needs to be coaching people, and this is where I come in to teach them how to do this safely and effectively, because, man, let me tell you, back pain doesn't discriminate against age, religion, ethnicity. It affects people of all ages. Andrew Agassi retired from tennis. Why?
Andre, right?
Back pain.
Back pain.
I called up his strength conditioning coach, Gil Gonzalez, who happens to be from El Paso, Texas, my hometown, but it was too late. He had already gone to the surgeons, and they were already going to do surgery. Mm-hmm. How many football players have retired because of back injuries?
Well, not only that, but not necessarily just the retirement part of it, but also there's the afterlife in football. I mean, the way you get your body bent, the way you get it twisted. Golfers, I'm a passionate golfer.
Right.
One of the greatest golfers of all time, if not, could be arguably the greatest, Tiger Woods.
Right.
Suffering with the back issue. Right. I mean, you're right, it doesn't escape us. But as we conclude here, this interview, how would you like people to get a hold of you?
Well, they can find me on my website, Dr. Carlos M. Gonzalez. They can find me on Facebook, Dr. Carlos M. Gonzalez. They can find me here on this video.
Thank you.
Joe, appreciate it. Thank you very much.
And thank you for having a lot
I
of
want to
people.
be your chiropractor.
I got it. Thank you.